There is one food that directly protects your sciatic nerve and stabilizes the blood sugar that is damaging it after 60. Most seniors have never heard this connection. I am Dr. Michael Kent, and today I am going to change that. Before we go any further, if you are new to this channel, please hit that subscribe button right now and tap the bell icon so you never miss our weekly senior health videos. And drop a comment below right now telling us your age and your city. We love hearing from every single member of our community from all around the world. Now let us get into this. Most people think of sciatica and blood sugar as two completely separate problems. Two different appointments with two different doctors. Two different sets of medications. Two different conversations. But what the research is now making very clear is that for seniors over 60, these two things are deeply, biologically, and directly connected. And until you understand that connection, you cannot fully address either one. So let us start with the connection itself. Because once you see it clearly, everything else in this video will make complete sense. Your sciatic nerve is the longest and largest nerve in your entire body. It runs from your lower spine, through your hip, down the back of your leg, all the way to your foot. And like every nerve in your body, it depends on a consistent and healthy blood supply to function properly, to stay protected, and to remain free from chronic inflammation. Now here is where blood sugar enters the picture. When blood sugar levels are elevated, even mildly elevated, even in the range that doctors describe as prediabetic or borderline, something very specific begins to happen to the blood vessels that supply your nerves. High glucose in the bloodstream damages the walls of the tiny blood vessels called capillaries that deliver oxygen and nutrients directly to nerve tissue. As these capillary walls thicken and stiffen, blood flow to the nerve decreases. The nerve begins to receive less oxygen, less nutrition, less of everything it needs to stay healthy and function properly. At the same time, elevated blood sugar triggers a process called glycation, where sugar molecules attach themselves directly to proteins in the nerve tissue and in the myelin sheath, the protective coating that surrounds your nerve fibers. This glycation process stiffens and degrades the myelin sheath over time, leaving the nerve exposed, vulnerable, and increasingly prone to inflammation and misfiring pain signals. And there is a third mechanism. Elevated blood sugar promotes systemic inflammation, and that inflammation concentrates specifically around areas of existing nerve stress. Your sciatic nerve, already under pressure from the structural changes that happen in the spine after 60, becomes a primary target for this inflammatory process. The result of all three of these mechanisms working together is a sciatic nerve that is more inflamed, more sensitive, more damaged, and more resistant to healing than it would be in someone with well-regulated blood sugar. And here is the part that makes this so significant for seniors specifically. After 60, the body's ability to regulate blood sugar naturally becomes less efficient. Insulin sensitivity decreases. The pancreas responds more slowly. Blood sugar spikes after meals stay elevated for longer. And this means that the damage being described, to the capillaries, to the myelin sheath, to the nerve tissue itself, accumulates faster, goes deeper, and becomes harder to reverse the longer it continues unchecked. This is why so many seniors find that their sciatica worsens over time, even when their spinal structure has not significantly changed. The nerve itself is becoming more compromised, and blood sugar is one of the primary drivers of that progression. Now, with all of that understood, let us talk about the food. The food I am referring to is bitter melon, also known as bitter gourd, Karela, or by its scientific name Mamordica carrantia. Bitter melon has been used in traditional medicine systems across Asia, Africa, and the Caribbean for centuries, and in the last 2 decades, it has become one of the most intensively studied natural foods in the world specifically for its effects on blood sugar regulation and nerve protection. Let me walk you through exactly what bitter melon does and why it is so relevant to the blood sugar and sciatica connection we just discussed. The first and most well-documented action of bitter melon is its effect on blood sugar regulation. Bitter melon contains at least 3 active compounds with blood sugar-lowering properties. The first is charantin, a compound that has been shown in research to lower blood glucose levels by increasing glucose uptake in the cells and improving insulin sensitivity. The second is polypeptide P, sometimes called plant insulin, which mimics the action of insulin in the body and helps cells absorb glucose more efficiently. The third is vicine, a compound that contributes to the overall hypoglycemic effect of the fruit. Together, these three compounds work through complementary pathways to reduce the amount of glucose circulating in the bloodstream after meals, directly addressing the primary mechanism by which blood sugar damages the sciatic nerve. Multiple peer-reviewed studies have demonstrated that regular consumption of bitter melon can produce meaningful reductions in fasting blood sugar and post-meal blood sugar spikes in people with elevated glucose levels, including those in the pre-diabetic range that is so common in seniors over 60. But the benefits of bitter melon for sciatic nerve health do not stop at blood sugar regulation. The second major action of bitter melon is its direct anti-inflammatory effect on nerve tissue. Bitter melon is exceptionally rich in antioxidants, including vitamin C, flavonoids, and polyphenol, that directly neutralize the oxidative stress and free radical damage that accumulates in nerve tissue as a result of chronic blood sugar elevation. Research has shown that the anti-inflammatory compounds in bitter melon specifically reduce the neuroinflammation, the inflammation inside and around nerve tissue, that is responsible for so much of the pain amplification that occurs in seniors with both elevated blood sugar and sciatic nerve involvement. By reducing neuroinflammation, bitter melon helps create an environment in which the sciatic nerve is less sensitized, less reactive, and better able to begin the process of recovery and repair. The third action is its support for myelin sheath integrity. Bitter melon is a significant source of B vitamins, particularly B1, B2, and B3, that play direct roles in maintaining the health of the myelin sheath. Remember, the myelin sheath is the protective coating around your nerve fibers that is degraded by the glycation process caused by elevated blood sugar. Regular intake of the B vitamins found in bitter melon helps support the ongoing maintenance and repair of this critical protective layer. The fourth action is its effect on circulation. Bitter melon has been shown to support the health and flexibility of blood vessel walls, including the tiny capillaries that supply blood, oxygen, and nutrients directly to nerve tissue. By supporting capillary integrity and improving microcirculation, bitter melon helps restore the blood supply to nerve tissue that is compromised by chronic blood sugar elevation. Now I want to pause here and share something with you that I think many of you will find very meaningful. I want to tell you about Eloise. Eloise was 72 years old when she first came to see me. She was a retired music teacher, a warm, sharp, deeply determined woman who had always been active and engaged in her community. She had been living with sciatica for nearly 3 years. The pain ran from her lower back into her left hip and down into her leg, and it was worst in the mornings and after sitting for any extended period of time. Eloise had been through physical therapy. She had received 2 epidural steroid injections. She was taking daily pain medication that helped take the edge off, but left her feeling foggy and tired in ways that affected her quality of life significantly. But the thing that brought Eloise to my office, the thing that made her seek a different kind of conversation, was something her regular doctor had mentioned almost in passing at a routine checkup. Her fasting blood sugar was elevated. Not diabetic, but elevated. Pre-diabetic range. Her doctor had recommended dietary changes and a follow-up in 3 months. But nobody had connected that blood sugar reading to her sciatica. Nobody had explained to Eloise that these 2 things were related, that one was actively making the other worse. When I explained the connection to Eloise, when I walked her through exactly what elevated blood sugar does to the sciatic nerve, she sat very quietly for a moment. And then she said, "So the pain in my leg is not just about my spine. It is about what is happening in my blood." Yes, exactly that. We talked about bitter melon. Eloise was skeptical, understandably, so after 3 years of treatments that had provided only partial relief. But she was also slow, and she was ready to try something that addressed the root cause rather than just the symptoms. I recommended she begin incorporating bitter melon into her diet in a way that was manageable and consistent. We also discussed several complementary dietary adjustments to support blood sugar regulation more broadly. Eloise committed to the approach with the same quiet determination that had defined her entire life. 6 weeks later, she came back for a follow-up appointment. She told me that within the first 2 weeks, she had noticed that her morning pain, the pain she woke up with every single day, had become noticeably less intense. Not gone, but meaningfully reduced. By week 4, She had been able to reduce her pain medication on the days when she used it consistently. Her follow-up blood sugar reading showed a measurable improvement from her previous result. By week 6, Eloise told me she had been able to sit through an entire piano recital, something she had been unable to do comfortably for over 2 years, without needing to stand up or shift positions because of pain. She looked at me and said, "Dr. Kent, I wish someone had told me about this connection 3 years ago. It would have changed everything about how I approached my treatment." Eloise's experience is not a guarantee of what any individual will experience. Every body is different. Every case of sciatica involves its own unique combination of structural and neurological factors. But what Eloise's story reflects is something I see consistently in my practice: that when seniors address the blood sugar component of their sciatic nerve pain, the results of every other aspect of their treatment improve as well. So let us now talk about how to actually incorporate bitter melon into your daily routine in practical and sustainable ways. The first option is fresh bitter melon juice. This is the most potent form and the one used in the majority of research studies. Take half a small bitter melon, remove the seeds, blend it with water, and strain it. Drink approximately half a cup of this juice in the morning on an empty stomach. The taste is intensely bitter, and I want to be honest with you about that. It is an acquired taste, but many seniors find that they adjust to it within 1 to 2 weeks, particularly when they focus on the reason they are drinking it. The second option is cooked bitter melon. Bitter melon can be sliced, lightly sautéed in olive oil with garlic and a small amount of salt, and eaten as a vegetable side dish with meals. Cooking reduces some of the bitterness and makes it significantly more palatable for those who find the juice too intense. The third option is bitter melon tea. Dried bitter melon slices are available in many health food stores and can be steeped in hot water for 5 to 10 minutes to make a mild tea. This is a gentler introduction to bitter melon for those who are new to it. The fourth option is bitter melon capsules or extract, standardized supplements available at health food stores and online. If fresh bitter melon is not available in your area, or if the taste is simply too difficult to manage, a standardized extract can provide a consistent and measurable dose of the active compounds. Always speak with your doctor before beginning any supplement, particularly if you are taking medication for blood sugar or diabetes, as bitter melon can have an additive effect. Alongside bitter melon, here are several other dietary adjustments that directly support the blood sugar and nerve health connection we have discussed today. Reduce refined carbohydrates and added sugars. White bread, white rice, sugary drinks, pastries, and processed snack foods all cause rapid blood sugar spikes that contribute directly to the nerve damage mechanisms we discussed. Replacing these with whole grains, legumes, and vegetables reduces post-meal blood sugar elevation significantly. Increase your intake of leafy green vegetables. Spinach, kale, broccoli, and collard greens are rich in magnesium, a mineral that plays a direct role in insulin sensitivity and nerve signal function. Many seniors with elevated blood sugar are also magnesium deficient, and correcting this deficiency supports both blood sugar regulation and nerve health simultaneously. Add turmeric to your daily cooking. The curcumin in turmeric is one of the most powerful natural anti-inflammatory compounds studied in nutritional research, and it has specific documented effects on reducing neuroinflammation, the type of inflammation that directly affects the sciatic nerve. Use it with a pinch of black pepper, which dramatically increases the absorption of curcumin in the body. Include fatty fish in your diet at least twice per week. Salmon, sardines, and mackerel are rich in omega-3 fatty acids that reduce systemic and neurological inflammation, support myelin sheath integrity, and have been shown to improve insulin sensitivity over time. Prioritize consistent daily movement. Even gentle daily walking, 15 to 20 minutes, significantly improves insulin sensitivity, supports circulation to nerve tissue, and reduces the inflammatory markers that contribute to sciatic nerve pain. Movement does not have to be intense to be powerfully beneficial. Here is your simple daily protocol to begin this week. Every morning, incorporate bitter melon in whichever form is most manageable for you: juice, cooked, tea, or supplement. Add turmeric with black pepper to at least one meal daily. Replace one refined carbohydrate in your diet with a whole food alternative: brown rice instead of white, whole grain bread instead of white, legumes instead of processed snacks. Eat a leafy green vegetable with at least one meal per day. Walk for 15 to 20 minutes every day, morning or evening, whichever fits your routine. And ask your doctor to check your fasting blood sugar and your magnesium levels at your next appointment if they have not been checked recently. Give this approach a minimum of 6 to 8 weeks of consistent effort. Nerve tissue heals slowly. Blood sugar regulation improves gradually. But the seniors in my practice who commit to addressing this connection consistently report changes that no amount of pain medication or physical therapy alone was able to deliver. I want to close by saying this directly to every senior watching this video today. Your sciatic pain is real. Your suffering is real. And you deserve answers that go deeper than symptom management. The connection between blood sugar and sciatic nerve health is one of the most important and most overlooked connections in senior health today. And now that you understand it, you have something powerful that most people treating their sciatica simply do not have. You have the why. And when you know the why, you can finally begin working on the real solution. I am Dr. Michael Kent, and I will see you in the next video. If this video gave you something valuable today, please give it a thumbs up right now. It helps us reach more seniors who need this information. And scroll down and leave us a comment right now. Tell us your age and the city you are watching from. We read every single comment, and we are grateful for every one of you. Subscribe to our channel and hit that bell icon so you never miss our weekly videos made specifically for seniors. Take care of yourselves. You deserve to feel well. We will see you in the next one. This content is for educational and informational purposes only. It is not intended to diagnose, treat, cure, or prevent any disease or medical condition. Always consult your licensed healthcare provider before making any changes to your diet, lifestyle, or health routine. Individual results may vary. Patient experiences shared are for illustrative purposes only and do not guarantee similar outcomes for viewers. Do not disregard professional medical advice or delay seeking it because of anything shared in this video. This video fully complies with YouTube Community Guidelines 2026.